We've used it with junior staff, and we've also used it with doctors as well. Anybody that's coming to join the trust will get induction with the suit, and what it has proved is it raises awareness of the difficulties of communication and carrying out general activities of daily living. It's raised awareness of how to communicate with people on the ward when you're serving them with meals, or just generally involving them in a communication. So we think that it enhances patient care, and it's certainly been beneficial for training throughout the trust. We've used it with healthcare assistants and new staff that are joining the trust, and today we have 3 healthcare apprentices from Huntingdon Regional College, and Katie is wearing the full suit, and the suit simulates what it might be like to have dementia or to be elderly and have restricted movement. So the glasses support distorted vision. Katie's also got some glasses on underneath. You lift them up a little bit, Katie, underneath here, which simulate cataracts. So she's got earplugs in, so that's affected her hearing. And as we become older, our joints generally become stiffer. So she's got the neck brace on, so it restricts head movements. And then she's got the body brace, which gives you that sort of stooped feeling. And then she's got weights around her hands. So if you lift your arms up, Katie, it shows how much more difficult it is to do everyday activities. And then she's got weights around her ankles and around her knees. How do you feel, Katie?
Horrible.
Would it make you think differently about how you talk and communicate with older people?
Yeah.
Okay. So if you'd like to try and get out of that chair for me. And that shows how much more difficult it is, doesn't it?
Yeah.
And if you had a chair there without any arms on, so if you sit back down again, and even sitting down is a little bit more difficult.
Yeah.
Try getting out of the chair and imagine you haven't got any arms either side to get yourself up.
I can't even tell.
Okay. So would that make you think now about how you get somebody in and out of a chair?
Yeah.
Okay. Mm-hmm. So if we ask you to walk over towards the window. And how does that feel?
Very restricted.
And if you were to look out of the window, how much can you see out of the window?
Not a lot.
Not a lot. So you'd feel a bit disorientated.
Yeah.
Miriam has got the other part of the suit, which is to simulate if you've had a stroke. So she's got a weakness all down her right side. How do you feel?
Horrible too. So weird. Like, feel really dead.
How would it make you react, and how would it make you treat patients now you've had this experience?
More patient, probably, with how they move and stuff.
Okay. And what about Emily? Do you think it'll affect how you are with patients?
Yeah, definitely.
Yeah.
Yeah.
Do you think it's a frightening experience?
Yeah.
Yeah. And Ellie, you've only got glasses on.
Yeah.
How do you feel?
It's really weird. You can't see anything at all. It's just like spots of light.
So when you give a cup of tea to a patient, would that make you different at how you was to do that?
Yeah, I can't see anything. If someone put a cup of tea in front of me, I'd be for ages trying to find it. Can't see anything.
Okay, thank you.